This is the lecture on project control by Professor Alemi. This lecture is part of the open online course on project management. During the project control phase, project management monitors project outcomes and associated risks. When a problem arises or is likely to arise, the project manager takes corrective action and reports progress to stakeholders. Projects fail for many reasons. Healthcare organizations are complex, with professional players who have semi-independent roles. In multi-year projects, changes in regulation is a factor. In almost all failures, poor communication is a key factor. When communication is poor, organizational resistance to change is high. Other reasons mentioned in why projects fail include constant and seemingly small changes in scope that affect the long-term effectiveness of the project. Projects may fail when no one is clearly responsible for its success and when organizational priorities are shifting. Finally, projects fail because they were bad ideas that did not reflect the customer's needs. In order to monitor projects' progress, project managers often have to forecast estimated time to completion and budget at completion. These two measures tell us how efficiently the project is being run. In addition, project managers need to measure the quality of the project, and this is often done by measuring how well the project is accomplishing its original goals. These goals should be described in terms of patients' experiences. A key impact to measure is patient satisfaction with care. Other factors to measure is patient's health status, including impact on mortality or morbidity with care. Still another factor to measure is cost of care. Let's look at an example. What should we monitor while we are implementing an IT help desk? We can start with the obvious two measures of project efficiency. That's estimated time to completion and budget at completion. Next, we could measure the impact on employee satisfaction with IT services. Is this a good idea? It could be, but it's not the impact on the end customer. We should ask what benefits emerge from clinicians who are satisfied with IT services, perhaps more use of electronic health record. This is still not a patient outcome. We should ask what benefits emerge from more use of electronic health records. Perhaps a lower number of medication errors as documented in improved patient health status. If this is true, then we should also expect lower cost of care as patients may be discharged earlier. All of this could also mean higher satisfaction with care. The point is that project managers need to monitor both project's progress as well as its impact on patient outcomes. Measurement of progress in the project is often done using the earned value management method. We will start with some terminology about earned value, then show how various terms are related to each other, and end with how the project manager uses the earned value to improve project control. The baseline budget of a project is the original planned budget plus approved new items. Planned value refers to the total cost planned to be spent on an activity. This is the same as the budget amount for an activity plus approved adjustments. In the plot, we see an example of expenditures in various months for a project. The x-axis shows months since start of the project, and the y-axis shows total expenditures up to each month. For example, the plot shows that we had planned to finish in 9 months. For example, the plot shows that we had spent up $60,000 by month 4. Actual cost refers to the total direct and indirect costs incurred by the project. This plot shows actual and planned costs of a project together. The dashed line shows the forecast of actual cost past current date if we continue to perform on the project at the same rate. The forecast of actual expenditures to project's end is referred to as budget at completion, or BAC. This is key variable that project managers track in their projects and report to their stakeholders. Earned value is the value of work completed to date. It can be calculated from planned value times rate of performance. Rate of performance is the ratio of actual work completed to the percentage of work planned to be completed. This figure shows planned cost, actual cost, and earned value on the same scale. Note how earned value is shown in solid green up to the time now, and how the green dashed line shows the earned value up to planned end date. The actual cost is shown in the blue and continues till end of project, which is a month later. Cost variance is the earned value minus the actual cost. If cost variance is negative, it means that it costs more to do the work than it was planned. Scheduled variance is earned value minus the planned value. A negative scheduled value means that it took longer than planned to perform the task. This graph shows the cost variance as the difference of earned and actual cost. This graph shows the scheduled variance as the difference of earned and planned value. The cost performance index is the ratio of earned value to actual cost. It can be used to forecast cost overruns. The scheduled performance index is the ratio of earned value to planned value and can be used to project time overruns. The estimated cost at completion is calculated as the ratio of project's entire budget divided by cost performance index. This estimate assumes that we progress with the project at the same rate as last calculated rate of performance. The estimated time to complete the project is calculated by dividing the original time estimate by the scheduled performance index. Again, this estimate assumes that we continue to perform in the rest of tasks of the project at the current rate. Let's look at an example where the rate of performance is 50%. That is, 50% of the planned work is actually done in a week 1. The planned value was $10,000 and the actual cost was $15,000. The question is, what is the earned value? The earned value is calculated from multiplying the $10,000 planned value by the rate of performance, which is 50%. The earned value is therefore $5,000. The cost variance is calculated as the earned value minus the actual cost. In this case, it is minus $10,000. The scheduled variance is calculated as the difference of earned and planned value. In this case, scheduled variance is minus $5,000. The cost performance index is calculated as the ratio of earned and planned value. In this case, this is calculated as 33%. The scheduled performance index is calculated as the ratio of earned and actual cost. In this case, the scheduled performance index is 50%. When monitoring a project, it's important to start the effort by reconfirming the plans. Then, project's progress is assessed and at designated intervals reported to key people through status reports. When necessary, a corrective action is taken. If more resources are necessary to get the project back on track, then a formal request needs to be made. If the project cannot finish on time and under budget, it's important to figure out the consequences of the delay on remaining activities of the organization. The take-home lesson is that project control requires monitoring progress using earned value.